द मोस्ट कॉमन पैथोलॉजी आस्क इन ENT आर दिस. इनमें से कोई एक क्वेश्चन तो वो डेफिनेटली पूछते हैं. इधर इट कुड बी ऑटोस्क्लेरोसिस, नॉइस इंड्यूस्ड हियरिंग लॉस, प्रेस्बाइक्यूसिस, मेनियर्स डिजीज या ग्लोमस जुगुलारे. हर एग्जाम में एटलीस्ट वन क्वेश्चन विल कम फ्रॉम दिस काइंड ऑफ पैथोलॉजी. सो वी विल गो वन बाय वन. So first is the autosclerosis. So what is autosclerosis? It is fixed foot plate of stapes. ये याद रखना, fixed foot plate of stapes. This can be found in young female with bilateral conducting hearing loss. Patient hears better in noisy area, which is also known as paracusis. इसमें हमें क्या दिखता है? Schwartz sign और Flamingo sign. Treatment of choice is stepidotomy. And इसमें most peculiar चीज़ क्या होता है? वो है Cahardt's notch. Cahardt's notch is dip at 2000 hertz. So these are the most specific points I have written here because they will give you hint in the question and based on that you have to mark the answer. So इतना तो आपको याद रखना ही है ऑटोस्क्लेरोसिस में. Autosclerosis is a differential diagnosis between noise induced hearing loss. So what is the difference? This was the fixed foot plate of stapes. This is a simple due to sudden loud noise will be a rupture of tympanic membrane, and due to that there will be hearing loss, and the damage will be in the organ of corti. Here the peculiar thing is there will be a dip at 4000 hertz. In autosclerosis it was dip at 2000 hertz, and in noise induced hearing loss the dip is at 4000 hertz. So this is the difference between autosclerosis and noise induced hearing loss. उसके बाद we will study about presbycusis and Meniere's disease. So what is presbycusis? It is a simple age related progressive sensory neural hearing loss. It is age related, and what we will see? We will see sloping audiogram in presbycusis, and the differential for presbycusis is Meniere's disease. What is Meniere's disease? First of all, it is also known as endolymphatics hydrops, or it is also known as glaucoma of ear. ठीक है. In hearing loss, the symptoms will be hearing loss, tinnitus and vertigo, and what we will see here is rising audiogram. ठीक है. And usually what we have to do is we have to decompress the ear, decompress the middle ear so that there will be no glaucoma of ear. अब इसके अंदर peculiar चीज़ें क्या आती है? वो आती है, first there will be the loud noise will be heard more loud, which is also known as recruitment phenomena. So even if we speak very slowly, the person will hear the sound very loudly. ठीक है. The second thing is due to loud noise the person will have vertigo. This is called Tullio's phenomena. The third thing is the same sound will be heard in two frequency. It is more like of an echo. This is also called a diplacusis. And last is the patient will fall down, but the patient will not lose his consciousness when there is a loud noise. This is also known as Tumarkin crisis. ठीक है. So in Meniere's disease, these are the important features and important points, the hints which they can ask. So to summarize, in autosclerosis क्या याद रखना है? Cahardt's notch, dip at 2000 hertz. In noise induced hearing loss, dip at 4000 hertz. In presbycusis there is sloping audiogram. In Meniere's disease there is rising audiogram. ठीक है. एंड बाकी ये सब तो हमें याद रखना ही है बिकॉज दैट कैन बी गिवन एज अ हिंट इन अ क्लिनिकल क्वेश्चन एंड वी हैव टू डायग्नोस इट. एंड द लास्ट थिंग इज ग्लोमस जुगुलारे. व्हाट इज ग्लोमस जुगुलारे? इट इज़ अ वेस्क्यूलर ट्यूमर. सो इट इज़ अ वेस्क्यूलर ट्यूमर. सो क्या कॉन्ट्राइंडिकेटेड होगा? हम बायोप्सी कर सकते हैं? नहीं कर सकते बिकॉज देर विल बी अ लॉट ऑफ कैपिलरीज इन देयर एंड अ लॉट ऑफ ब्लड विल बी देयर. सो सिम्टम्स भी क्या होंगे? फर्स्ट विल बी hearing loss and second will be bleeding from the ear. And what are the features is rising sun sign and brown sign. So इन सब में से एटलीस्ट एक क्वेश्चन तो आता ही है. आई रिमेंबर लास्ट अभी जो जनवरी 2025 में जो एग्ज़ाम हुआ था उसमें क्वेश्चन आया था रिगार्डिंग ऑटोस्क्लेरोसिस डिप एट 2000 हर्ट्स. ये वाला क्वेश्चन था और हर एग्ज़ाम में मैंने देखा है एक क्वेश्चन तो आता ही है. सो आई रेड दिस एंड आई हैव रिपीटेड revised it. So जैसे क्वेश्चन आएगा you will know what to answer. So autosclerosis, noise induced hearing loss, presbycusis, Meniere's disease and glomus jugulare is very important. So revise it again and again. and the notes will be in my Telegram group. And next I will try to start surgery, the most important topics, because in surgery they ask around 30 question, and from my notes I made just 2 pages of surgery notes, and उसमें से ही 6-7 क्वेश्चन तो आ ही गए थे. तो I will try to make it in a good handwriting, and I will share the notes in my Telegram group. The Telegram group link is in the description, and please share this to your friends also, and subscribe to the channel so you will know about my new videos. Thank you.